Hello, friends. Happy Monday, everybody. If you are anywhere near me in the Midwest, it is a very snowy Monday, but hopefully you got to take a break a little bit and tune in today live with us for another episode of Learn with Lo. So if you're new here, I'm Lauryn Moore. I am the host of Learn with Lo and the owner of the Lowdown Functional Medicine Practice. So I'm really excited for this platform because we really get the opportunity to dive into some deeper topics, more so than just some of your soundbite medicine that we can show on Instagram, right? And really get into the nitty gritty. And so this month of February, we've been really getting into the weeds with our autoimmune conversation. Autoimmunity affects more than 50 million Americans. We've talked about some of those really staggering statistics and how we're seeing a 300% increase in instances of autoimmune cases and over 80% of those affecting women. So this is a very, very relevant topic for a lot of people. Either they're actively seeking out some sort of diagnosis, they've recently been diagnosed. I'm almost positive that everybody at least knows somebody who struggles with an autoimmune diagnosis because there's over 120 different autoimmune diagnoses that all fall under the same kind of umbrella, right? So when we think about it from more of a conventional medicine perspective, we've gotten to really understand how terms are defined a little differently from more of a conventional medicine understanding to a functional medicine understanding. Conventional medicine really talks about autoimmune patterns being a random or mistakenly attacking, right? You kind of hear some of these really strong words and verbs around what the body is actually doing in an autoimmune situation, where it's randomly attacking our own body tissues, right? Whereas what we actually have come to realize through more of a root cause mindset or a functional medicine perspective is maybe the immune system is doing exactly what it's supposed to do because it's trying to protect us from something. Now, that's where we've been able to really dive in and identify well, what the heck is it trying to protect us from, right? So if you've been following along with our autoimmune series, we've really dove into redefining and re-understanding autoimmunity, because if we're not looking at autoimmunity from a different lens, then we're not going to get a different treatment plan, right? We're going to get the same treatment, whether that's lifelong medications and lifelong immunosuppressants and specialist after specialist, and really just a life of managing symptoms and managing flares, versus if we're actually of the mindset of asking the question, well, oh, that's interesting. Maybe my immune system isn't randomly or mistakenly attacking me. Maybe it's doing exactly what it was designed to do, but it's actually protecting me from something. And now the question becomes, what is it protecting me from? Now we open up a whole new conversation and also a whole new opportunity for healing and full remission instead of a lifelong diagnosis, right? So we really talked last week about the stages of autoimmunity, because again, from a more of a conventional medicine perspective, it's when we think about mistakenly and randomly attacking our tissues, sometimes it comes off as this process happens overnight. All of a sudden I have Hashimoto's, all of a sudden I have Crohn's, all of a sudden I have rheumatoid arthritis or fibromyalgia. It's like, no, these things are not just an overnight process. They're actually something that happens over time and it builds. So there's 3 stages to autoimmunity, which we got to discuss last week. And more from a conventional medicine standpoint, a lot of our classic training and testing really doesn't identify autoimmune patterns for a lot of people until it's full-blown stage 3, until there are active autoimmunities present and there's also extensive tissue damage present, because that's what's happening. The immune system is going to gradually atrophy these tissues, and so there's actual dysfunction. We have way more symptoms than maybe just stage 1 silent autoimmunity or more of that reactive autoimmunity. So conventional medicine, unfortunately, really isn't catching a lot of this autoimmune disease until stage 3, which is why it takes people on average 5 to 6 years to get a full-blown diagnosis, even though we intuitively know that usually years or decades before, we don't feel right? We're struggling with some of those more silent autoimmune symptoms: excessive fatigue, brain fog, joint pain, gut issues, right? Hair, skin, nail kind of issues. And it's like, inflammation in general is trying to rear its ugly head, but we just keep getting reassured from our conventional medicine, oh, your lab testing looks normal, ship shape, and we just kick the can down the road a little bit, versus from a functional medicine perspective, when we start to recognize like, oh, autoimmunity happens in a spectrum, we can actually test for a lot of these auto antibodies in stage 1. And I can't tell you how many women that I've seen who come into practice and I test some of their thyroid antibodies and they're like, nobody's tested those for me before. I'm like, that's interesting, because you do have a low presence of these autoimmune antibodies, like kind of cooking, right? And so we get to have that conversation of like, we're probably catching this in more of a stage 1 or a stage 2. So intercepting that, we can prevent it from ever getting to a stage 3, and not only have you feeling better, but also prevent a full-blown autoimmune diagnosis in the future. Because then what usually I see happen is individuals, they'll finally get an autoimmune diagnosis when it's in stage 3. And then what happens is maybe a year or 2 later, they have another autoimmune diagnosis, right? And it's like, that's because we never really got to the root issue of what the immune system is responding to. We just decided that having an autoimmune diagnosis using some medications or some immunosuppressants was enough, when in reality, we're really starting to see like, maybe there's more to the picture or more to the equation. So if you missed any of our first few episodes of this series, I encourage you to go back and catch up, because you're going to start to ask whole new questions when it comes to autoimmune patterns, whether you personally are dealing with them or you have a loved one that's struggling with autoimmune patterns. And you're also going to start to see how the progression of it kind of lends us to identifying it early and also treating it way differently, okay? So now that we understand that autoimmunity is not just a random attack on the body, it's actually a response to something deeper that needs to be addressed, and that autoimmunity isn't necessarily a life sentence. You're not destined to necessarily be on these types of medications forever. If you truly believe that that's the case, your body really does have the capacity to heal if given the right tools. So today, I really want to build on these autoimmune conversations and start to talk about really the meat and potatoes, the bread and butter of what a lot of you are probably asking about, which is, okay, how do we actually approach autoimmunity from more of a root cause perspective? So today's episode, I really want to break down kind of that root cause medicine toolkit, or more of our functional medicine roadmap to putting autoimmunity into remission. What actually works? Where do we start? How do we support the body to reach full remission, instead of just accepting that our good enough standards is just minimizing symptoms, right? I truly want to address like, what is the body going after? Where is the source of this inflammation? Because there's probably something bigger under the scenes brewing that the body is trying to turn our attention to, but sometimes we're just not identifying it correctly, okay? So how does functional medicine, or maybe I say functional medicine, how do I at the lowdown and my lowdown methods, how do we approach autoimmune disease? We know what's driving autoimmunity, but how do we address it from a functional perspective? We're not just going to band-aid symptoms. I want to ask why. Why is the immune system overreacting in the first place? Okay. Now, there's going to be multiple different steps to this. Some of these will be physical steps, and also, you know, my jam, if you've been around a while, there's also going to be a lot of mindset medicine that goes into this as well too, because the really cool thing about autoimmunity is really what we're seeing is a self versus not self boundary breach. Okay. And I'll explain what that means in a minute. But when you think about an immune system that's randomly attacking itself, its own tissues, that's like really a great question mark in my mind of like, why does the body see self as not self? Where are we living inauthentic to ourselves? Where are we breaching boundaries with ourselves? We're letting other people's energy in where we can't separate like my energy and my needs from like your energy and your needs, which is more than likely why we see 80% of autoimmune diseases happen in the female population. Okay, there's a lot of energy leaks in our standard American woman. And usually that comes from a very big burden of different patriarchal roles, excessive like perfectionism, type A high achieving personalities, taking on a majority of caretaking responsibilities for the home. It's just a lot, right? And so it's hard for them to really denote like self versus not self. And there's kind of an infiltration happening of not self coming in. And so our true essence and true nature of ourselves is attacking that, right? It's like, that's not me. That's not authentic to me. I actually wanted to say no to that PTA meeting, but I said yes anyway because I'm just a people pleaser and I can't say no. Or like, not self because like I really don't jive with this group of friends, like they're not really authentic to me, but I like pretend to be somebody that I'm not around them just to feel like included with this mom's group or whatever, right? But it's like this isn't really authentic to me and my energy, right? So there's so much mindset medicine that comes along with this as well too. So of course, am I going to talk about gut health, leaky gut, toxin exposure? Hell yes, I'm going to talk about that. But I think the very first thing that I really want to talk about is shifting our mindset towards healing. Because I will say that there's a big difference between someone approaching autoimmunity from a functional medicine perspective and getting a lot of symptom relief, but then that full remission. I'm not going to lie, that full remission of autoimmunity, it's not just physical. This is someone that's willing to approach and really like, for lack of better words, own their shit when it comes to not just the physical piece, but also the mental or the mindset piece as well too, which is so fun to kind of dig into together. And like I said, I think both of these worlds can really converge. So when I start off by talking about the mindset shift that really needs to happen, I start there because I think some people just they don't start there. They think that's just like an extra or like the frosting on top. And I'm like, no, like really to bring full fruition here, we're going to want to make sure that we understand that mindset is part of this because autoimmune patterns are literally your body displaying self versus not self. And so there's going to have to be a point in time where we're willing to come to the table and potentially kind of discuss like, what are some non-self things that are being breached? What are boundaries that are being breached? Where are we being inauthentic? Where are we leaking our energy or where are we absorbing other people's energy that's not ours? Okay. That's a big one. So when I talk about shifting our mindset first, like this is part of the low down methods to approaching autoimmune patterns is the mindset medicine. So number one, before we start any of like your physical protocols and strategies, we really need to start with the mindset and we need to, number one, challenge the conventional belief behind autoimmunity. Because if we conventionally we still think that autoimmunity is a life sentence and we truly believe that we're going to live with this forever, then you will. Okay. So first off is like, you can't come into this work not believing that that is a possible outcome. Okay. Because otherwise like, yeah, then whatever you say to yourself, like actually will be true. Right. So whether you believe you can or you can't, you're right. Okay. So conventional medicine kind of tells us that autoimmunity is permanent. Your only option is medication. Your immune system is broken or it's attacking you for no reason or you have no control over your healing. Like those are things that we hear from a conventional medicine standpoint all the time. But really the reality or the mindset shift that I encourage and really help people get into is that remission is possible and that I have seen it happen countless times of autoimmune patterns by not just suppressing their symptoms, but by removing the triggers that are overreacting your immune system in the first place. Also, your immune system is not broken. It is responding to something. We just have to figure out what that something is. And you have way more control than you've been led to believe. Okay. So even just shifting the mindset of like disease management to like remission mindset, we're not just suppressing symptoms, we're truly asking what is triggering the response in the first place? How do I remove that trigger so that I can calm the immune system down? Okay. So like the big first task, I'm not saying that this is like you have to tackle all of this before you get into any of the physical protocols that I'm going to discuss next, but I think the mindset has to be woven in behind the scenes, at least at the same time. Okay, because if it's not happening at least simultaneously, where we're really adopting and accepting a mindset that remission is possible, I am in control of my body and my immune system in my body is not broken. It's just responding to something, and I need to figure out what that is. And part of that something might also be energy leaks within my life of self versus not self, and boundaries that I'm breaching within my own boundary or within my own life as well too. So the mindset piece, like, it's a big chunk of it, and it's super, super fun to dig in together. But I think, like I said, I don't want to just leave that to the end and be like, oh, that's frosting on top, because it's really going to determine a big trajectory of your experience as well too. So mindset medicine is going to be the first part. But then step number 2 is now we can start to really get into what someone might look at more of, like the functional medicine protocols behind a roadmap to autoimmune remission. Number 1, you're probably not surprised to hear me say this. We got to heal the gut. This is going to be like the bread and butter and the foundation of autoimmune healing. 80% of your immune system lies in your gut. If your gut is inflamed, if you have intestinal permeability, you have the intestinal permeability that's led to food sensitivities, like your immune system is on high alert. Common gut triggers is going to be things like leaky gut, gut overgrowths, right? Like fungal overgrowths, yeast overgrowths, bacterial overgrowths, hidden infections, food sensitivities. We really have to approach this from a place of, like, number 1, we do not pass go, do not collect $200. We have to take a look at what the heck is happening in the gut. And this is where I usually use more targeted testing, because we can't really see the gut much in blood work. I'm not going to lie. There can be some inferences where I can kind of see maybe how stomach acid is doing, or how bile production is doing, or how the liver is detoxing, but it's really hard to see the gut health in blood work. So this is where I kind of rely a lot on stool testing, or in strategic situations, I might need some breath testing, some things where we can really start to look at, do we have leaky gut? Do we have bacterial dysbiosis? Do we have yeast or fungal overgrowths? Do we have parasites? What's the state of our immune system? What is the state of our overall stomach acid, bile flow? Like, all of that right there is like, oh, like that is a huge part of the autoimmune inflammation process. And if you've been actively diagnosed with an autoimmune pattern, you absolutely have gut dysfunction. And with that gut dysfunction, you're probably not going to be able to put autoimmunity into full remission until we tackle that. Now, this is not probiotics, colostrum, green juice, gluten-free. It's not exactly what I mean when I say heal your gut. Like, this is a deeper dive of, we have to look at what is the overall state of the good guys versus bad guys. And we probably need to do a complete microbiome restoration here. Okay. So healing the gut's a really, really big one. Secondary to that, which is pretty close to and usually included within a lot of the gut restoration work, is going to be identifying and removing specific triggers. Okay. So when it comes to a gut that's dysfunctional, or when it comes to an autoimmune pattern that is not in remission, it is very easily triggered. Okay. And it's triggered by anything that the body deems as self versus not self, right? We've talked about this. So things that that come into the body, that to the body, it can't break it down fully, it doesn't recognize what it is, those types of things are going to potentially be immune triggers and can throw somebody into an autoimmune flare, okay? So for some people, this is food sensitivities. Sometimes it's gluten, sometimes it's dairy, sometimes there's even more individual sensitivities that are deeper, like things like lectins or oxalates, right? So it's about getting very personalized, but this is not about elimination diets, because the whole reason is we're asking why. Why is that food a trigger? That's weird. Oh, that food is a trigger because my gut is dysfunctional, right? So it's not the food. It's not just like, oh, I'm going to put someone on an autoimmune paleo diet and it's going to put their autoimmunity into remission. It's like, no, it's just stopping them from having future flares. until we can go and actually correct what the autoimmune patterns are promoting. Okay. So sometimes as part of the treatment strategy, doesn't have to be a forever thing. So some people are like, oh my gosh, I don't ever want to go down this road for my autoimmunity because she's just going to put me on this elimination diet. I'm like, no. Actually, it's complete opposite. My goal is for you to eat as many foods as humanly possible, all of the wide diversity that you tolerate. But if there are specific foods that are acting as a strong autoimmune trigger, like I'm going to temporarily maybe have to remove those with the goal of being able to reintroduce them in the future. So it may be food sensitivities. It could be things like environmental toxins as well too. It could be things like endocrine disrupting chemicals. And it could be things like hidden infections in the body, right? So this is where we may need to use a lot more detoxification support for individuals, sauna therapies, liver support, binders, dry brushing, castor oil packs, all of those types of like deeper detoxification kind of work, right? So not as a forever piece, but like we might have to do some strategic elimination, and we probably need to do some strategic detoxification work as well too. Other part of that gut healing strategy, like I said, we may have to remove some triggers. We're definitely going to have to support the immune system, right? So what we don't want to do is suppress the immune system. We want to support it because the immune system is there doing its job. The immune system is working on our behalf. So if we just come in and suppress the immune system, the body's like, wait, I was trying to help you out, but you just come in and take away all of the resources that I have to fight against this thing. And now what do you want me to do, right? You're shutting off or suppressing the immune system when in fact, like we need the immune system on our side for sure. So that's where like commonly in conventional medicine, when someone is more in an active autoimmune diagnosis, they're going to get steroid medications, they're going to get biologics, they're going to get immunosuppressants. And sometimes I'm not saying that those are bad, but they're not promoting remission for us because they're just kind of kicking the can down the road. So we really want to make sure that we're taking into account the overall immune system. We want to bring support to the immune system. We don't want to suppress the immune system. So of course, we're probably going to have to bring in some very nourishing foods from this standpoint. Omega-3s are going to be big here. Polyphenols are going to be huge here. And then also we need to think about like overall fat soluble vitamins, A, D, E, and K. We can use some anti-inflammatory things. There's lots of immunoglobulin support that can be really helpful and therapeutic for an immune system that's like overreacting to things, right? We maybe need to think about digestive enzymes and some brush border support, right? So lots of different tools in that box, but what you don't want to do is suppress the immune system. You want to support it, okay? And then last but not least, we cannot talk about this. We kind of talked about this with the mindset piece, but we also have to support the nervous system. Okay. So sometimes when there is chronic stress in the picture, that is going to keep the immune system into overdrive, which is why we also talked about the connection between past trauma or individuals' adverse childhood experiences or their ACE score. Those are very tightly correlated with an increased incidence of autoimmune patterns into adulthood, right? So we really maybe need to, like I said, bring in some of that mindset medicine as well, whether that's breathwork support, somatic healing, nervous system regulation practices, vagal nerve healing strategies, tracking things like heart rate variability and HRV. There's so many mind-body techniques here that are going to be part of the overall strategy as well, okay? So when it comes to like the physical body, right, call it like the head down, the gut is going to be a major component. And when I say the gut, it's not just how you poop every day. I'm talking about like, how are we digesting our food? How am I absorbing my food? What about my immune system in the small intestine? What about my detoxification pathways coming from my liver and from my skin? What about the colon? What about the microbiome? What about leaky gut? Like there's so many pieces. When someone says gut health, I'm like, which part, right? There's a huge component of that. And we want to be very comprehensive in that approach, because that is really where a lot of these autoimmune patterns are coming from and why we're seeing a 300% increase of incidence in this honestly, guys, it goes back to the gut. So from a conventional medicine standpoint, they try to treat autoimmunity all differently. It's like, oh, if you have Crohn's disease, we're going to send you to a gastroenterologist, versus if you have rheumatoid arthritis, we're going to send you to a rheumatologist, or you have Hashimoto's, we're going to send you to an endocrinologist. And it's like all of these autoimmune patterns are the same etiology, right? There's a genetic predisposition, there's a leaky gut, and there's environmental triggers, right? So it's like, why are we treating them all different and sending them off to subspecialties, which are just managing their symptoms, but not really treating it from an underlying root cause perspective? That's the bigger picture umbrella, okay? So when you think of about more of, like I said, a conventional medicine standpoint, it is more, you're going to be on these medications forever. This is a lifelong label for you. Here's your medications, like call us if you need more, kind of thing, right? Versus functionally, I'm zooming out and I'm asking, what is the immune system responding to? How am I going to remove that? And how am I going to overall restore the environment and support the immune system, not just suppress it? Okay, so lots of different treatments that we're going to use here, all the way from more advanced functional testing to give us better data, all the way to using nutrition in a way that's nourishing and restorative, not restrictive, right? That's going to be the opposite of what a stable immune system is going to want, is just this like overly restrictive approach, right? And then we're also going to bring in a lot of the mindset medicine to ensure that we are thinking around the right mindset towards putting our autoimmunity into remission, but also that we're including the part of the treatment that makes sure that we're digging to that next layer deeper of identifying self versus not self, because that's probably, to me, I just love, like I said, if people are like, oh, that's the woo-woo. I'm like, I love the woo-woo. Give me the woo-woo, because that's where I see probably the most transformation happen, is individuals that are really marrying together the physical body medicine, but also being willing to come to the table. I'm like, let's talk this out. Where are instances in your life where you feel like there are boundaries being breached? Because internally in your body, that's essentially what's happening, is you have a giant boundary breach of self versus not self. So if that's happening inside your body, it's happening outside your body. Okay, where is that happening, and where do we need to shore up some of those self versus non-self boundaries? So that, like I said, gets into the woo-woo. That's what sets the lowdown apart from how a lot of other people are tackling autoimmune patterns. And I'm not shy to say that, because I've seen it work, and I love the work that I do, and I believe in it wholeheartedly. So hopefully that was helpful for you guys to kind of hear a different perspective, way deeper of a functional medicine toolbox than just some of our biologics and immunosuppressants. So if this is ever of interest to you, or you feel like you yourself or someone you know is struggling with autoimmunity, please send them this video, send them this series, so that they know that there is hope out there. If you are interested in getting started for this journey yourself, first step would just be scheduling us an initial consultation where we can run some comprehensive labs, get some of those early stage markers of inflammation and autoimmune autobodies that are happening in the blood work, so that we can really start to see whether this is a pattern that's developing for you or not. So you can always sign up for a functional wellness consult. Click the link in my profile that will take you to my website, where you can schedule that as well. So hopefully this was helpful for you. Thank you for joining in on our autoimmune series, and we'll be back next week to wrap it all up.